My name is Celine Awor. I work at the International Institute for Legislative Affairs, IILA. This is a national CSO in Kenya that works on the policy space, specifically to ensure that Kenyans, we have policies that actually address issues affecting Kenyans. So we work a lot with policymakers, CSOs, and also media to advocate for these policies on various thematic areas, including public health, specifically NCDs, prevention and control, where tobacco control work sits squarely, and we've worked on tobacco control for the past 10 years or so. I think that the first big thing was, Kenya ratifying WHO FCTC and then domesticating it through the National Tobacco Control Act of 2007, which provides a legal framework to implement and enforce the provisions that are provided for ensuring that tobacco control policy interventions actually support the public health agenda of the country. And I think Kenya has really made some good progress in implementing and enforcing Tobacco Control Act, as well as the Tobacco Control Regulations of 2014. For instance, if I can just pick maybe a few areas of the Act that I think we've made some good progress on. Number one would be TAPS, which is a total ban on tobacco advertising, promotion, and sales and sponsorship, which I think as a country has made us achieve some good gains when it comes to tobacco control and trying to reduce and eliminate access of these products through adverts that would lure the public to the products. Then I think we've also made some progress when it comes to tax issues, also being one of the provisions that are in the Act, where we've, as a country, we've made progress in trying to harmonize and reform the tax administration structure and increase tobacco taxes. I think also as a country, led by Ministry of Health, Division of Tobacco Control, as well as Tobacco Control Board, I think as a country we've made some progress in terms of putting in place policies that support tobacco control interventions in the country. And just the other year, the Ministry of Health launched the National Tobacco Control Strategic Plan, which provides very clear strategic objectives of where the country needs to go when it comes to tobacco control issues. Then I think also we've made some progress when it comes to, still on the part of putting in place policies, having launched, developed and formulated the National Guidelines on Cessation on Tobacco Products. So when it comes to also trying to implement other parts, other provisions of the Act, which are quite varied, including issues of provisions of Tobacco Control Fund, which have now been operationalized through the Tobacco Control Regulations. I think the country is making some good progress. And of course also the CSOs have been doing a lot of good work when it comes to generating evidence and supporting government in terms of pushing for better and implementation and enforcement of the Act. And lastly, also I think one of the big things that as a country we have achieved so far is the ratification of the ITP, that is the Protocol to Eliminate Illicit Trade in Tobacco Products, which Kenya became a party to in May this year. So I think those are quite some good achievements that Kenya has made so far. And of course, banning smoking in public places, I think that is a key thing that we've achieved, although there are some gaps and you still find some of these provisions being violated, but then now that's an issue of enforcement. There are a number of challenges, but I think the big one, amongst the key ones, number one would be limited resources or lack of resources to support tobacco control interventions, both at government level and also at the CSO's level. Not having sufficient resources to effectively implement and even enforce, the provisions of the Tobacco Control Act, as well as CSOs to be able to do what they're supposed to do best in terms of generating evidence and, having advocacy activities that support government to effectively implement and enforce the Act. and the CSOs, mostly depending on donor funds, then it becomes a bit restrictive in terms of how much they can get and how much they can do. I think another big challenge we've had in Kenya is tobacco industry interference. I think we cannot talk about challenges and not mention tobacco industry interference. We have seen the industry interfere on a wide scale, and I think the biggest or the most significant example we can give is the just concluded court case that was instituted by the industry on the tobacco control regulations, which lasted about 5 years until the case was finally completed in November 2019. The other challenge I think we have is limited capacity. I think even at government level, and this would cut across both national and county, given that we have most of these functions under health, including tobacco control, being devolved to the county level, such that they now need to play a bigger role in enforcing and implementing the policy set at the national level. And these are the government, the county governments and the units at the county levels do not necessarily have this capacity to play their role when it comes to implementing and enforcing tobacco control. So you find that you look at, for instance, Nairobi, both as a city and a county, and you compare the level of compliance at this level and in the other counties, then of course you see that in Nairobi, the level of compliance is higher, as opposed to the, because of the fact that Nairobi being the capital city and where the national activities were housed for a long time. So this lack of capacity to effectively enable the county governments to play their role when it comes to supporting tobacco control enforcement and implementation is lacking, and something needs to be done about that. I think the move and the discussion that has been going on the past few years, even at the regional and global level, is that there's need for countries, including Kenya, to really be deliberate about mobilizing domestic resources for tobacco control. As I mentioned earlier, the CSOs that work on tobacco control, including IILA, the support to enable this work that most of us do mostly comes from donor, is donor fund driven, and these resources are not, they are always limited. So the Tobacco Control Fund actually is a very good opportunity to provide that domestic resources that would support tobacco control intervention programming in the country, both for government and the government agencies, and also for the non-government actors like CSOs. So definitely it is a very good thing that the regulations, the case that was hinged on the regulations were the case was determined, and now the regulations now need to be enforced. And one of the key aspects of the regulations is the operationalization of the Tobacco Control Fund. So as IILA, we've been working together with the Tobacco Control Board and a few stakeholders just to advocate for operationalization of that fund so that it is effective, it is operational, and CSOs as well as other players have a chance to access some resources in a way to support tobacco control programming in the country. Government, and in this case we are referring to the Ministry of Health, specifically Tobacco Control Division and a Tobacco Control Board, including the Secretariat, first of all have supported the process by virtue of having in place policies and legislation on tobacco control that also recognize and provide the space for CSOs to engage in tobacco control in their level in terms of advocacy and other activities. When it comes to industry interference, maybe the other aspects of the policy provisions we have, I think the challenge becomes in enforcement and implementation. For instance, when it comes to issues of industry interference, our Act, which now have those specific provisions brought down in the regulations, Tobacco Control Regulations 2014, have some requirements that the government need to fulfill when it comes to governing interactions between public officers and the industry. And I think we still have some weak points in this space. For instance, probably the government needs to even develop some kind of guidelines or some codes of conduct that govern and provide the guidelines on how public officials need to engage or interact when they have to interact with the tobacco industry. And this goes beyond the Ministry of Health. And I think because of that gap is where we get certain things happening, like what happened with the registration of lift, because the tobacco control is not just a function of the Ministry of Health. Yeah, there are several other government agencies and ministries that also have a role to play. So when they are not aware of the obligations of Kenya as a country under the FCTC and the obligations of Kenya under the Tobacco Control Act, and specifically when it comes to relations and interactions between government and industry, then there becomes a problem. It provides loopholes for industry to exploit and manipulate, to move around and employ whatever tactics to interfere with tobacco control policy work. So I think a lot still needs to be done, especially at the government level, in terms of putting in place very clear guidelines and as required by the FCTC and also our Tobacco Control Regulations 2014. When it comes to the CSOs, what the biggest role that CSOs play when it comes to industry interference is being vigilant and collecting data and monitoring and sharing this information for response and for action to be taken. Most of the time, this action and response then needs to be taken by government in some cases, most cases actually. So there needs to be that cooperation and coordination amongst the various actors, and this also would be affected by having that kind of guidelines, and even just as simple as creating awareness amongst the colleagues at the government level. So of course the key player here at the government level being the Ministry of Health, but then now the Ministry of Health needs to coordinate, even when it comes to creating awareness amongst their colleagues in the other government agencies so that they are aware of their roles and obligations under the FCTC and our own tobacco control